Gwegwe Kahnawake, welcome to the COVID-19 Kahnawake Task Force Daily Briefing. Today is Wednesday, March 60th. Just kidding. Wednesday, April 29th. The illustrious Joe Delarone had to take a day off today, much deserved. The guy has only had 2 in the last 6 weeks. So today we have Lisa Westaway and Lloyd Phillips on, and in between we'll go over those survey results to get some in-depth discussion on that or analysis. And but first, just to get us started, I'd like to bring up the Executive Director of the Kahnawake Memorial Hospital, Lisa Westaway.
Thank you. Good afternoon. So we want to talk about the health check. We've spoken about it here before, but we wanted to let you know that we're ready to go. So as of tomorrow, you're going to start to receive phone calls from the KMHC staff. They'll be calling using the Kahnawake directory, and they'll be going, we have 4 or 5 staff members who will be calling all of your homes to assess your health, the health of you and your family members, and to give you some advice regarding that. So it's really with respect to the symptoms of COVID-19. So if you ask them any other medical questions, they will not be able to answer you. They'll refer you back to your regular physician. However, they will be calling specifically about COVID-19 symptoms. And with the goal, of course, to be able to arrange mobile testing so that we can come to you to test you at your home. We're trying to facilitate the process as much as possible. Again, what we want to know is we want to have a good idea of what the profile is of the community, so that when we make decisions for reopenings or other decisions, we're making it with the best information possible. Having a good idea of what's happening in the community allows us to make those better choices and decisions. It also ensures the safety of all of you, and for you guys to have a better idea of what's happening for yourselves. One of the main things we hear about not wanting to come and get tested is the fact that people do not want to self-isolate. And we actually saw that in the survey that was done and that Neil will speak to you about. We saw that people who were tested, that there was a great percentage of those people who did not self-isolate. So I just wanted to remind you that testing is not the predicting factor of when you should self-isolate or not, but rather the development of symptoms. So once you have symptoms, and those that we've spoken about often, cough and or fever and or respiratory issues, one of those or 2 of the following, it could be headache or gastro symptoms, runny nose, achy feeling, very much like cold-like symptoms. In any of those instances, you should be self-isolating, meaning separating yourself from your family and from and you know, keeping in your own space in a room with your own bathroom. And again, the directives for self-isolation are on the KMHC website. So I really would, I highly recommend that when we call, that if you are seeing no caller ID, that you pick up the phone. We're really working hard to work with you so that we're all safe. So please answer the phone. If you do not have a landline, we already received some calls today with people's cell numbers, so that's great. That's wonderful news, and I urge you to continue to do that. If you don't have a landline, that you call us, 638-3930, extension 2296 or 2295. We'll also have all the information about the health check on our website, where it's going to be in both newspapers this weekend. It'll be on the radio. You cannot get away from us. No, just kidding. So we really ask that you go through with this health check, because it's really in the best interests of the community as a whole. I wanted to talk a little bit about, when we talk about reopening, Lloyd gave a lot of information yesterday and we'll talk about it again today. But there's one thing that I wanted to focus on that is especially important, is the idea of social distancing and the idea of what is normal. So we are, I want to bring forth the idea so that we can start processing this and start thinking about it, is that our new normal is going to be very different from our pre-COVID-19 normal. So even once we start reopening, social, there are a few main variables that dictate success in the reopening phases. And one of those variables is that we continue to avoid gatherings. It's usually the last element on the list when we start to reopen, and we've seen this in many European countries who are a bit ahead of us in the process. Those who are succeeding are those who continue to test, and therefore that's why we're really pushing the testing. So those that continue to test and self-isolate when they have symptoms, and that we avoid the social gatherings. So our new normal will still consist for quite a long time with keeping within your family unit. So I know it's difficult, it's very difficult, but I just bring it up today so that we could start processing that information and be ready for it. Even when we start opening up businesses, in very small increments, we will still have to maintain social distancing. We'll still have to go from work to home and stay within our family unit. The whole idea will be to maintain infection prevention and control measures, hygiene measures, and social distancing. So I wanted to just thank Moochie Goodleaf, who was in front of the hospital today with his music, and a whole bunch of people singing and dancing, and that was done for all of the residents at KMHC, who were really overjoyed. So we saw people, you'll probably see tons of pictures of it on Facebook, but many people who were listening, dancing, who were really, really very overjoyed and overwhelmed. I say overwhelmed because some of the staff went outside and we were all overwhelmed, in fact, with the situation, and it was really beautiful. So thank you very much for that. Just a little reminder that when we do these things, we have to still maintain social distancing even when we're outside. But it really was a beautiful moment, so thank you very much for that. So that's my updates today. Again, please answer the phone tomorrow. This is really important. We really urge you to participate. Okay, thank you.
Now, Lisa. So we're going to get to that survey, but I'll just touch on a few things that Lisa just talked about. Today I was one of the people that the callers called just to test out some of the questions. And I'm telling you, it's really easy. They're very nice. They're very professional. And it's not like telemarketing at all. I mean, they're asking you, I mean, they're there for you, actually, if you think about it. And I would say just have an open mind, and please participate when they do call your home, or call the hospital if your number's not listed, of course. So the survey we did was a 1-month review. We did it a few weeks ago in mid-April. To go through that, there were 9 questions. The survey can be found on the COVID-19 website. It's covid-19.kmhc.ca/survey. So the first question was just about whether you're not from Kahnawake. 93% were from Kahnawake. Now, what was interesting about the stat, though, was the 7% who are essential workers, who are not from Kahnawake, had the same results. Like, we actually cross-referenced it. They had the same exact results as those from Kahnawake, so at 1 or 2% off maybe. But what's nice about that is that our essential workers think just like us at a time like this on these issues, so that was pretty cool. The second and third question talked about how often do you leave your home, and it went hand in hand with the next question, which was why. So how often you leave your home was kind of spread across the board. To make it easy, we'll say who leaves 3 or more times a week, or who leaves 2 or less. So 2 or less, the ones who stay home more often, 55%, 45%, 3 or more times. So the key was why. Essential reasons such as groceries, medical, etc. Were given, 88%. The number 2, though, was surprising. 42% said exercise, and we'll get into that a bit later, but that's cool. I mean, people like Wima, Philip Gibson, all these exercise gurus will be really happy that people are staying in shape. We actually want that number up, 42%. We want more Kahnawake staying in shape. People for work actually was third, 40%, so people still working. Thank you for all those who are working right now. And so it makes sense that 45% would leave their home 3 or more times a day if 40% are working. And then what was nice to see too is that only 5% said they go out for food or snacks, alcohol, etc. So it's nice to see only 5% risk COVID-19 for a coffee crisp or what have you. Question 4 was about the 6 feet distancing that Lisa was talking about. So 92%, really good number, 92% of you said when you're out there, You never, rarely, or sometimes come within 6 feet of people, so that's pretty cool. The ones who exercise actually had the same number. So the ones who go out for exercise often, 92% of them also stay 6 feet apart, so that's really cool. More people, here's a fun one for you guys who stay home versus those who have to go out more often. The ones who stay home more often, 96% of them actually come within 6 feet less. 86% for those who go more often. So it's the more often you're going out, the closer you're coming into contact with people is basically what that's telling us. Number 5, what directives are you following? So 18% on each for whether or not family and friends visit, as well as 18% said that they visit non-community members for non-essential reasons. But in their comments, there were certain reasons given. So there's some understanding there. 34%, as she talked about, self-isolated out of the total number, less than 70% of those tested. So we'd like those numbers higher if you have symptoms. And 96% said they washed their hands always, often. So you're a bunch of beasts, Kahnawake. Keep washing them hands. Number 6, how often do you follow the directives of the task force? Over 95% said always, often. Always or often follow. Nobody, not one person said never. That was nice to see. And only one person said rarely. And it wasn't me, Lloyd. Trust me, it wasn't me. It wasn't me. Only one person said rarely did they listen to the directive, so that's pretty cool. Number 7, symptoms. So Lisa talked about the symptoms. 79% said no, they didn't have any symptoms. 13% felt they had mild non-COVID related symptoms, and we think this is the part where you're not sure, you don't think it's COVID related, so you don't feel the need to get tested. And then this is what the health check hopes to find out. I know they were already in the process before the survey, but I'm thinking that's what'll happen. Like they'll ask you questions about different symptoms. Do you have this? Do you have? And it's just important to think about it and answer. Number 8, 31% of you said you see others not listening to the directives of the task force, while 95% of you in question 6 said you listen. So the ones answering are saying they listen, but they're seeing others. Really, it should have been 5%, so we had to dig into that. And one thing I noticed, what was common about these 31% saying they see others not following the directives, was that they were alluding to outsiders coming in for different reasons, cigarettes, whatnot. They also mentioned youth. And typically, outsiders and youth aren't taking these types of surveys, so that's probably why those numbers spiked a little. And the last question was just where are you getting your information? And 88% of you right here on Kahnawake 911. And one of the reasons for that is the star of the show, and we save him for last. Last but not least, our, I won't say illustrious because I used that on Joe Delarone, but Public Safety Commissioner Lloyd Phillips.
Thank you very much, Neil. Thank you, Lisa. Kahnawake. Welcome to another update session for the COVID task force. Certainly, I welcome the results that Neil had just put out. It shows a few things, and most importantly, people are taking this pandemic very seriously. And secondly, it shows that people are abiding by the directives set forth by the task force, and it also shows that there is a high level of support for the decisions that have to be made by the task force. So I thank you very much, Kahnawake, for following the directives, for being supportive, and it truly means a lot to us to see numbers as high as 95% in compliance. So thank you very much for that. Just a few items for this afternoon, just maybe a couple of clarity points. I know this has been mentioned a few times over the past couple of days, just regarding the schools. Again, all Kahnawake schools are not going to be reopening for this year. All high schools outside of Kahnawake are not going to be opening this year as well. It's only the elementary schools outside the communities who are being opened by the province. And even those, they're only asking for very small class sizes, and it's not going to be mandatory. So I know some people have been asking, what's the position of the task force? What happens if my child is going to go to school? And the other way around, if they do go to school. So we had a discussion yesterday with the task force. The education system is doing some more research. They're going to be reaching out to the parents, and we're going to be tabling that officially on Friday for a full task force discussion. And by Friday afternoon, I'm confident we'll have a clear direction for the community, as well as that goes hand in hand with bus transportation. So stay tuned for that, but we'll have that full update for you on Friday. As promised to the community, we're going to be reviewing the directives. As a matter of fact, that had started today. We've been going through the directives and assessing each one on any potential modifications that may be required, and that will be again presented to the full task force on Friday for them to review and look at the recommendations and decide the best way forward. But based on where we are today, and the fact, as we mentioned, sure, we're looking at the reopening plan of businesses, and we're looking at the reopening plan of organizations, and things of that nature. There still needs to be the understanding that don't expect major changes in directives at this point. There may be some little tweaks here and there. In the weeks to follow, things will evolve, things will change. We keep telling people that we're reviewing them. And that's going to start today. It'll be reviewed Friday. We have a meeting on Monday, so it's going to be an ongoing assessment, an ongoing review of various directives. So when you tune in here on a day-to-day basis, we may have additional modifications that we'll announce on a daily basis as required or as needed. Also, with that, I just want to remind the community, so as we speak today, all the directives are still in place. There has been no modifications done to them. If there's going to be any modifications or any tweaks to them done, you'll hear about that on Friday. So again, please stay tuned for that. And maybe a couple other points I just want to finish off with is you may have listened to the news. If not, there was some further comments made by Quebec about how they're going to be lessening the measures or the restrictions for travel in between regions. As you know, like from between here and Joe Rodo, there was some checkpoints that were set up, and various people ran into those checkpoints and were questioned where they're going and so on. Effective next week, those checkpoints will be removed, as well as in the weeks to come, the other checkpoints in other parts of the province will also be coming down. But one interesting thing they did mention is they said that for Indigenous communities, who are not prepared at this point in time due to the vulnerability of their communities, the decision has not been made. In some cases, not Kahnawake, maybe that the decision may be made by the provincial government or in conjunction with the provincial government. But for Kahnawak's sake, that decision, as mentioned before, will be made by the Kahnawake COVID task force on when we want to open up and when we want to see things change. So that I just want to emphasize again. Similar to what I mentioned a few weeks back, we're not looking for any approvals from the outside, but it's certainly good to hear them recognizing the fact that we have the authority and the jurisdiction in our community that we will make those decisions for us without interference, by the outside and without any influence from the outside. So I just wanted to raise that, for the community to be clear on where we're coming from. And for today, I was reminded about the Kahnawake vision statement. That's the one that we see all over the community. It's posted by the Caisse Populaire and by the post office and many places throughout the community. And matter of fact, there's a lot of work happening community-wide to bring that vision statement to life, along with comprehensive community planning and many things that are happening. And I was reminded of a clause in there, and it really makes sense to where we are today. And one of the clauses that reads, it says, "We are a community of close-knit families maintaining our connection with each other, where elders are admired, treasured, and called upon, where children are safe, provided, guidance, and loved." So that kind of summarizes, why we're here today. And that comes right out of the Kahnawake vision statement. So just keeping that in mind, That's what has been guiding us, even though we haven't said it in those exact words. That's been guiding us. The health and safety is a paramount and will remain a paramount. That's guiding the task force forward. And with that, remain strong, Kahnawake, and thank you very much. Kahnawake.
Now, Lloyd, I don't think we should say anything more. That just about sums it up for today. Thinking about the vision of 2029. Now, Lloyd and Lisa, and be back tomorrow. Joe Delarone will be back tomorrow. Ladies and gentlemen, thanks for tuning in, and we'll see you next time.